Hi there, I'm Aubrie. I am a certified physician assistant, and welcome back, or welcome, to my pre-PA FAQ series. So today's question is, how many patient care hours is considered competitive? Much like all of these questions I'll be answering here, it really depends. Somebody's application, you can have like a perfect GPA and apply to a school that doesn't really look at hours as much, and you only have like 500 hours, and that's perfectly fine and they get in. But some schools want to see thousands of hours. So kind of it's hard to answer because it really depends on where you apply, but this is generally what I've seen. So I would say a good amount of schools require at least 1,000 hours, a good amount. There are some that require 500. There are some schools that don't require hours at all, but I feel like I've seen 1,000 be the bare minimum for a lot of programs. So I would recommend shooting for that. Obviously, I would take a look at all the schools you're applying to and see if they have a higher requirement or if they put more emphasis on wanting to see people with hours, like a good amount of hours. But I would say bare minimum, shoot for 1,000. However, it is beneficial to obviously have more. If you can shoot for 2,000, that would be great. Some people come in with like thousands of hours, which that's hard, especially if you're coming out of undergrad and you're not a career changer, or you're not somebody that's worked in medicine for a long time and just wanted a bigger scope of practice. But I would say for people who do not come from that background, 1,000 bare minimum, shoot for 2,000. And if you end up having to take a gap year or having to reapply, having more hours is extremely beneficial. So even if you reach that 1,000 or 2,000 point, don't just stop there. The more experience you get is not only competitive on your application, but it also makes sure that you have a lot of experience in healthcare, and that will help you so far as like you'll be able to go so far your journey in PA school, and then obviously in your career as a PA, having more experience, even if it's not a field that you end up working in, is just so helpful. I have seen some schools require 2,000 hours, and some of them have even required 2,000 paid hours, but that's also few and far between. I've only seen like one or two schools require that. But majority have seen 1,000 hours. Some will take volunteers, some won't. It kind of just really depends, but that's kind of my basis of recommendation. I ended up getting about like 1,600 hours. By the time I actually started school, I had well over like 3,000, but that all didn't count because I had got accepted in, was it December of 2019? And then I started August 2020. So I'd already been accepted, and that whole chunk of like hours that I got before I actually started the program didn't count for anything. So I ended up only when applying had about 1,600 hours. I was shooting for 2,000, but didn't quite get there. I was close, but it was a little, I was like 300 and something hours away from it. But that was definitely kind of my goals, was the 2,000 point, because that's slightly more competitive than 1,000 and kind of stands out a bit more. So I would say bare minimum, shoot for 1,000 hours, unless you're applying to schools that you know don't require that many hours. Even then, I still say the experience is so beneficial, even if you're not trying to do it to be competitive, which still makes you competitive. But even if you're not doing it to like get into school, I think it's still so much more beneficial to have more experience going into school than kind of being just super fresh or not really being comfortable around patients or in uncomfortable situations. So it's not just to make you competitive or like check something off the list. It's to make you more prepared to be a medical provider, especially since PA school is so short compared to other, like a doctor. Anyways, so 1,000 minimum, 2,000 recommended, more if possible. That's kind of the generalized what I've seen recommended for a lot of places, from a lot of people. Again, I always answer these questions with like a giant asterisk saying like this does not apply to everybody. This is just a generalized recommendation based on kind of the averages that I've seen out there and the schools that I've looked at across the country and what they require. Some schools averages, some people, they'll say that their average student has had 5,000 hours. And obviously that can be heavily skewed by career changers, but that program may really want someone with a lot of hours. So even if you have the 2,000, it still may not be as competitive as somebody coming in with years of experience as a paramedic and then coming with like 8,000 hours. So that's why I recommend getting as much as possible and kind of making your application well-rounded, because there are some outliers that come in with a lot of experience and it's hard to compete with that. Not impossible, but it is challenging, and that's why I always recommend pushing yourself and getting as many as possible. All right, so that's kind of my opinion and my kind of guideline of what I recommend to get for patient care hours. If you have any questions, you can always leave a comment down below or message me on my Instagram at whitecoatchasing. If you have any questions that you would like to see me do in one of these videos, you can leave a comment below or message me directly and say you'd like to see this question answered, and I will put it into the series because I'm trying to answer as many general pre-PA questions as possible in this, so I have a good reference to kind of just send these to people when they ask these questions, because I think this explanation is a little bit better than me kind of writing out a small message on Instagram, so I thought that this would be a bit more helpful. All right, thank you so much for watching, and I hope you have a good rest of your day, and I hope that this is helpful.